Hello everyone, Dr. Mandell here. Today I want to talk about something very important, your arteries, your circulation, and how well oxygen and nutrients are reaching every cell of your body. Most people worry about blocked arteries only after a serious diagnosis. But the truth is, arterial plaque and stiffness begin quietly, sometimes decades before symptoms appear. Fatigue, cold hands and feet, leg pain while walking, brain fog, erectile dysfunction. These are often circulation problems, not just aging. Now, you've probably heard that beets are great for blood flow, and they are. Beets contain nitrates that convert into nitric oxide, which relaxes blood vessels. That's well established. But today, I want to talk about a simpler, more accessible vegetable that many people overlook. And in some cases, it may support arterial health even more consistently than beets. I'm talking about garlic. Garlic is not new, it's ancient medicine, but modern science is now catching up to what traditional cultures understood thousands of years ago. Let's talk about what actually happens inside your arteries. For decades, we were told that clogged arteries were simply pipes filled with fat, that cholesterol alone was the villain, and that aging meant an unavoidable narrowing of the vessels that carry life itself through the body. But modern science tells a far more unsettling story, one that changes everything we thought we knew about heart disease, stroke, and circulation. The real problem begins much earlier, long before a blockage ever appears, long before chest pain, long before a diagnosis. It begins when the inner lining of your blood vessels silently stops responding. Inside every healthy artery is a delicate, living layer of cells called the endothelium. This lining is not passive. It constantly senses blood flow, pressure, oxygen levels, and chemical signals. And in response, it releases a molecule so powerful that without it, life as we know it would not be possible. That molecule is nitric oxide. Nitric oxide is what tells your arteries to relax, to widen, to allow blood to flow freely. It is what keeps vessels elastic instead of rigid, responsive instead of brittle. When nitric oxide levels drop, arteries do not suddenly clog overnight. They slowly stiffen. They lose their ability to open. Blood flow becomes restricted even when no plaque is visible on a scan. This is why people can suffer heart attacks with normal cholesterol and clean-looking arteries. The vessels have lost their ability to function. Research shows that nitric oxide production declines with age, stress, smoking, high blood sugar, chronic inflammation, and even poor sleep. By middle age, many people are producing only a fraction of the nitric oxide they once did, and they don't feel it happening. They just notice colder hands, slower recovery, reduced stamina, mental fog, higher blood pressure, and subtle changes that get dismissed as getting older. But this decline is not inevitable, and this is where garlic enters the story. Garlic does something extraordinary inside the human body. When a clove of garlic is crushed, it releases a sulfur-containing compound called allicin. Allicin is unstable, but that instability is precisely what makes it biologically active. Once it enters the bloodstream, it transforms into a family of sulfur compounds that directly interact with the endothelium. These compounds stimulate the production and preservation of nitric oxide, not by forcing the body, but by restoring the biochemical environment the body needs to make it naturally. Studies published in cardiovascular and nutrition journals show that garlic improves endothelial-dependent vasodilation, meaning arteries regain their ability to widen in response to blood flow demand. This is not a theoretical benefit. It has been measured in human subjects using flow-mediated dilation tests, a gold standard marker of vascular health. Poor flow-mediated dilation predicts heart attacks years before they happen. Garlic improves it. But what makes this even more compelling is how garlic protects nitric oxide after it is produced. Nitric oxide is fragile. It is easily destroyed by oxidative stress, particularly by free radicals generated from smoking, pollution, high blood sugar, and processed foods. Garlic's sulfur compounds act as antioxidants specifically in the vascular system, shielding nitric oxide from destruction long enough for it to do its job. In other words, garlic doesn't just help you make nitric oxide, it helps you keep it. As nitric oxide availability increases, arteries begin to relax. Blood pressure gently declines, not because the heart weakens, but because resistance inside the vessels decreases. Blood moves with less friction. Oxygen reaches tissues that have been underfed for years. This is why improved circulation from garlic is felt not just in the heart, but in the brain, the legs, the kidneys, and even the smallest capillaries that supply nerves and skin. And there is a reason nitric oxide was named Molecule of the Year by the scientific community. Without it, the cardiovascular system collapses into rigidity and inflammation. And garlic is one of the few foods shown repeatedly to influence nitric oxide signaling in a clinically meaningful way. What makes this even more striking is that garlic does this without the tolerance effect seen with some nitrate-based drugs. Medications that boost nitric oxide can lose effectiveness over time as the body adapts. Garlic works upstream, supporting the body's own regulatory systems rather than overriding them. This is why populations with habitual garlic consumption show lower rates of hypertension and vascular disease, even when other lifestyle factors are imperfect. Another shocking fact is how early endothelial dysfunction begins. Autopsy studies have shown impaired nitric oxide signaling in teenagers with poor diets. The damage starts silently. Garlic intervenes at this earliest stage before arteries harden, before calcium settles into vessel walls, before blood flow becomes a crisis. This is prevention at the cellular level, but garlic's impact doesn't stop at relaxation of vessels. Nitric oxide also acts as a signaling molecule that tells the immune system to calm down within the arterial wall. Low nitric oxide is associated with increased adhesion of inflammatory cells to the endothelium, a key step in plaque formation. By restoring nitric oxide, garlic reduces this inflammatory adhesion process. This means fewer immune cells burrowing into artery walls, fewer foam cells forming, and slower plaque progression. In people already diagnosed with cardiovascular disease, this matters enormously. Even partially blocked arteries can deliver adequate blood flow if they retain the ability to dilate. Many heart attacks occur not because an artery is 90% blocked, but because a moderately narrowed artery suddenly loses its ability to open. Nitric oxide is the difference between survival and catastrophe. Clinical trials using aged garlic extract have demonstrated improved vascular elasticity and reduced arterial stiffness, a direct reflection of enhanced nitric oxide signaling. Arterial stiffness is one of the strongest predictors of cardiovascular mortality, stronger than cholesterol in some studies. Garlic addresses this root mechanism. And perhaps the most emotionally striking truth is this: the body remembers how to heal. Endothelial cells can regenerate, nitric oxide pathways can be restored. Blood vessels are not dead pipes. They are living tissue responding every second to the chemical messages we give them. Garlic delivers one of the clearest messages possible: relax, open, restore. This is not about megadoses or extreme interventions. Studies show benefits with the equivalent of 1 to 2 cloves a day, consistently over time. It is the daily signal that matters, not the dramatic one-time effort. Garlic is not aggressive, it is persistent. When people say they feel better circulation, they are not imagining it. Improved nitric oxide affects energy, mental clarity, warmth in the extremities, and exercise tolerance. These are real physiological changes, not placebo effects. Blood is reaching places it struggled to reach before. And this is why garlic stands apart from many so-called superfoods. It doesn't just provide nutrients, It restores communication inside the vascular system. It reopens dialogue between blood flow and vessel walls, between demand and response. In a world where cardiovascular disease remains the leading cause of death, the idea that something as simple as garlic can support the body's most fundamental protective mechanism is both humbling and empowering. It reminds us that modern medicine did not invent healing. It studied it. Nitric oxide is not optional. It is life. And when it fades, disease follows quietly. Garlic helps turn that signal back on, one clove at a time, one vessel at a time, restoring function where silence once lived. The tragedy is not that arteries clog. The tragedy is that they lose their voice long before anyone listens. Garlic helps them speak again. For years, we were taught that blocked arteries were the result of fat piling up like grease in a kitchen drain. Eat less fat, lower cholesterol, problem solved. But the truth that emerged from decades of cardiovascular research is far more disturbing and far more revealing. Plaque does not begin with fat. It begins with injury. It begins with inflammation. Inside your arteries, inflammation acts like a silent fire. You don't feel it burning. You don't see it spreading, but it slowly damages the inner lining of your blood vessels, creating microscopic wounds. And the body, trying to protect you, responds by sending cholesterol, immune cells, and calcium to patch the damage. Over time, those patches harden, they thicken, they narrow the vessel. What we call plaque is not the disease. It is the scar left behind by years of inflammation. This is why people with normal cholesterol still suffer heart attacks. It is why statins alone do not stop cardiovascular disease. And it is why targeting inflammation has become one of the most important frontiers in heart health science. Garlic directly interferes with this inflammatory process at its root. Multiple studies have shown that compounds in garlic significantly reduce key inflammatory markers linked to arterial damage, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha. These are not obscure lab values. Elevated CRP alone can double or triple the risk of heart attack, even in people without obvious blockages. Garlic lowers it, but the story goes deeper than blood markers. When inflammation rages inside an artery, immune cells called macrophages migrate into the vessel wall. There they consume oxidized LDL cholesterol and transform into foam cells, the earliest visible stage of plaque formation. Garlic interrupts this transformation. Its sulfur compounds reduce LDL oxidation, meaning fewer cholesterol particles become inflammatory triggers in the first place. Less oxidation means fewer foam cells. Fewer foam cells means slower plaque growth. This is not theory. It has been demonstrated in both human and animal models. Garlic changes the biological behavior of cholesterol, not just its quantity. And then there is calcium. Calcium buildup inside arteries, known as vascular calcification, is one of the most dangerous and irreversible aspects of heart disease. Once calcium hardens inside the vessel wall, arteries lose their flexibility. They can no longer expand to accommodate blood flow. This stiffness dramatically increases the risk of heart attack, stroke, and sudden cardiac death. Here is the shocking part. Coronary artery calcium is often a stronger predictor of heart events than cholesterol levels themselves, and garlic is one of the few natural compounds shown to slow this process. Clinical trials using aged garlic extract have demonstrated a significant reduction in the progression of coronary artery calcification compared to placebo. In some studies, participants taking garlic showed nearly 80% less progression of calcium buildup over a year. That is not a minor effect. That is a profound slowing of a process once thought unstoppable. How does garlic do this? Inflammation drives calcification. When arteries are inflamed, the cells in the vessel wall begin to behave like bone-forming cells. They actively deposit calcium as if trying to reinforce damaged tissue. Garlic suppresses the inflammatory signals that trigger this transformation. By calming the immune response inside arteries, garlic helps prevent vessels from turning into rigid pipes. At the same time, garlic improves the function of the endothelium, which acts as a protective barrier between blood and vessel walls. A healthy endothelium resists calcium infiltration. A damaged one invites it. Garlic strengthens that barrier. There is also the role of oxidative stress. Free radicals accelerate both inflammation and calcification. Garlic's antioxidant effects are not generic, they are targeted. They work inside lipid particles, inside vessel walls, and inside immune cells, neutralizing the oxidative signals that push plaque toward hardening. What makes this especially compelling is the time frame. Inflammation does not destroy arteries overnight. It works slowly, silently, year after year. Garlic works the same way, quietly, cumulatively, persistently. This is why consistency matters more than dose. 1 clove a day, every day, sends a repeated message to the immune system: stand down. People often ask why they feel better circulation, less stiffness, or improved energy after months of garlic use. This is why. Reduced inflammation restores flexibility. Softer arteries transmit pressure more smoothly. Blood moves with less turbulence. Organs receive steadier oxygen delivery. The body operates with less internal resistance. Another overlooked effect is garlic's influence on platelet activity. Inflammation makes blood stickier. Platelets clump together more easily, increasing clot risk. Garlic reduces excessive platelet aggregation, improving blood flow while lowering the chance of dangerous clots forming on unstable plaque. This is especially important because many heart attacks occur when an inflamed plaque ruptures and triggers sudden clot formation. Garlic helps stabilize plaque. Stable plaque is far less likely to rupture. This alone can mean the difference between life and death. And unlike aggressive pharmaceutical anti-inflammatories, garlic does not suppress the immune system. It modulates it. It brings balance rather than shutdown. This is why garlic has been safely consumed for thousands of years across cultures with some of the lowest historical rates of cardiovascular disease. The tragedy of modern heart disease is not that we lack solutions. It is that we focused on the wrong target for too long. We chase numbers instead of mechanisms. Garlic addresses the mechanism. Inflammation is not aging. Calcification is not destiny. Arteries do not have to harden just because time passes. They harden because the environment inside the body tells them to. Garlic changes that environment. It lowers the signals that scream danger inside the vessel wall. It reduces oxidative chaos. It quiets immune overreaction. And in that silence, healing becomes possible. This is not about miracle cures. This is about biology responding to consistent input. When you give your body anti-inflammatory signals every single day, it adapts. When you remove the constant inflammatory assault, arteries stop defending themselves with scars. Garlic is not dramatic. It does not shock the system. It whispers to it. And over time, those whispers reshape the future of your blood vessels. Heart disease is not a sudden event. It is a long conversation between inflammation and injury. Garlic changes the conversation. And sometimes that is enough to change the ending. High blood pressure has been called the silent killer for a reason. It does not announce itself. It does not warn you. It quietly damages the body every second of every day, carving microscopic scars into the walls of your arteries while you go about your life unaware. Nearly half of adults worldwide now live with elevated blood pressure, and most of them feel completely normal until the damage is done. Stroke, heart attack, kidney failure, vision loss, these are not sudden events. They are the final chapter of a story written by pressure. Every heartbeat sends a wave of force through your arteries. When blood pressure is high, that force becomes violent. The delicate inner lining of the vessel is hit again and again, like a shoreline eroding under constant storm surge. Over time, the endothelium cracks, inflammation rises, plaque forms, clots become more likely. This is how pressure becomes pathology. Garlic intervenes at this exact moment. Clinical trials conducted across multiple countries have shown that regular garlic consumption can significantly lower both systolic and diastolic blood pressure, often by amounts comparable to first-line blood pressure medications. In people with hypertension, reductions of 8 to 10 millimeters of mercury have been documented. That number may sound small, but epidemiological data shows that even a 5-point drop in systolic pressure can reduce stroke risk by more than 30%. This is not coincidence. This is chemistry. Garlic influences blood pressure through several overlapping mechanisms. One of the most important is its ability to reduce vascular resistance. As nitric oxide availability improves and inflammation declines, arteries relax. Wider arteries mean less force is required to move blood forward. The heart no longer has to fight against a rigid system. Pressure drops not because the heart weakens, but because the pathway opens. Garlic also affects the renin-angiotensin system, a hormonal cascade that controls blood vessel constriction and fluid balance. Overactivation of this system is a major driver of hypertension. Garlic compounds have been shown to reduce angiotensin II activity, a powerful vasoconstrictor that tightens arteries and raises pressure. When this signal is dampened, vessels loosen and pressure eases. But blood pressure is only part of the danger. The real killer is what happens when pressure, inflammation, and plaque collide. Inside inflamed arteries, blood does not flow smoothly. It becomes turbulent. Platelets, tiny blood cells designed to stop bleeding, become hyperactive in this environment. They clump together more easily. This increases the risk of clot formation, especially near unstable plaque. Most heart attacks are not caused by slow blockage. They are caused by sudden clots that form on inflamed plaque and instantly cut off blood flow. This is why someone can feel fine one moment and collapse the next. Garlic reduces this risk in a quiet but profound way. Studies show that garlic decreases excessive platelet aggregation, making blood less sticky without shutting down normal clotting function. This is critical. The body still needs to stop bleeding when injured. Garlic does not interfere with that. Instead, it prevents platelets from clumping unnecessarily inside arteries where they do not belong. This antithrombotic effect lowers the risk of clot-driven events like heart attacks and ischemic strokes. In populations with high garlic consumption, rates of fatal cardiovascular events have historically been lower, even when other risk factors were present. There is another layer to this story that often goes unnoticed. Thick blood increases blood pressure. It moves more slowly. It creates more friction against vessel walls. Garlic improves blood rheology, the way blood flows. By reducing inflammation, oxidative stress, and platelet clumping, garlic allows blood to move more freely. Lower resistance means lower pressure. Better flow means less clot risk. These effects reinforce each other. And then there is the reality of daily life. People often ask whether garlic works if you are already older, already diagnosed, already taking medication. The answer from research is clear. Garlic works best as a long-term, consistent support regardless of age. Studies involving participants in their 60s and 70s still show improvements in blood pressure, vascular function, and inflammatory markers. The body does not stop responding just because time has passed. What matters is how garlic is used. Raw garlic provides the strongest short-term biological signal because of allicin. Crushing or chopping activates it. Letting it sit for several minutes allows the compound to form fully. 1 to 2 cloves daily is enough to influence vascular health. More is not better. Consistency is. For those who cannot tolerate raw garlic, aged garlic extract offers a powerful alternative. This form has been studied extensively and is particularly effective for blood pressure reduction and arterial protection without stomach irritation or strong odor. It works more slowly but more steadily. This is not a quick fix. Garlic does not override decades of damage in a week. It sends daily instructions to the cardiovascular system. Relax, open, calm, flow. And the body listens. Over months, pressure stabilizes, blood moves more smoothly, the risk of sudden clot formation declines. These changes are subtle, but their impact is enormous. The most shocking fact is not that garlic works. It is that such a simple intervention can influence the most complex and deadly disease process in the modern world. High blood pressure is not just a number on a screen. It is mechanical stress tearing at living tissue. Garlic reduces that stress. Clots are not random. They form where inflammation and turbulence meet. Garlic separates them. Heart attacks and strokes are not accidents. They are endpoints. Garlic helps change the trajectory long before the endpoint arrives. This does not replace medical care. It does not negate medication when needed, but it strengthens the foundation upon which all treatments depend: healthy, responsive blood vessels. The cardiovascular system is not meant to operate under constant pressure and threat. It is meant to adapt, expand, and respond. Garlic restores that adaptability. One clove, one capsule, one daily habit. In a world where heart disease remains the leading cause of death, the quiet power of consistency may be the most underrated medicine of all. Garlic does not shout. It does not rush. It protects the body the same way damage occurs: slowly, silently, relentlessly. And sometimes that is exactly what saves a life.